Orthopedics was of interest to me probably at an early age because I was always very active physically. Played a lot of sports as a child, in high school, and even as a young adult. And when you play sports, you inevitably will get injured. And so I had a pretty significant ski injury when I was in my early 20s. Knee blew up, couldn't walk on it for weeks. And that's how I got interested initially in orthopedics, as I wanted to figure out and learn more about what happened to my knee and how I could fix it and or prevent future problems, not only for myself, but also do the same for others. St. Mary's is a Catholic hospital, and I'm actually a practicing Catholic. I spent 26 years in the military, and the last 10 years at Walter Reed. Walter Reed is a massive complex with hundreds, if not over 1,000 physicians, so it's a little impersonal. It's great for some things, not so great for others. It's nice, having retired from the military, to come to a smaller facility and a place where you pretty much know almost everyone here. It's also nice to see a place where the focus is not always just on performing a certain number of procedures or taking care of a certain number of patients, but taking care of perhaps those that are on the fringe of society or those who are often overlooked because our society may not value everyone the same. Several of the orthopedic surgeons here at St. Mary's were colleagues of mine at Walter Reed. And as they gradually came up here and they looked to expand the practice, we stay in touch, and every now and then you get a phone call or an email, or you see someone at a national meeting and you have a conversation. And that's how St. Mary's sort of was brought on my radar, and that's how I was made aware of the need for a sports surgeon here. And that's what brought me here. My favorite part of my job would be a successful surgery. When a patient comes in with a mechanical problem, that's what orthopedics is, whether it be a broken bone or a torn ligament or bad arthritis, you diagnose them and you fix them. And so then when the patient comes back, and they're thrilled because their pain's gone, they're back to being mobile, and their problem has been fixed. And so getting that patient satisfaction back is very rewarding. So seeing happy patients with fixed problems is a nice feeling.